Okay, let me give you a little idea about lung transplant today. Lung transplant is a modality which is still to pick up in a big way in India, and we are starting it at Apollo Hospital, New Delhi. Now, the lung transplant is actually reserved for only those people who have reached their end stage lung disease. When I say end stage lung disease, that means the patient is so symptomatic, so breathless, or having cough and other things that he cannot even perform normal duties, normal activities at home, and may be totally dependent on oxygen. So the quality of life is poor, and also the longevity is very limited. So the patient has a risk of dying of complications or worsening breathlessness within a few months to a year or two. So this is the kind of patients who are now considered for a lung transplant. And lung transplant is done from cadaveric donors. We are not doing living donor transplant at the moment. So we have to do a very strict, close monitoring, and of course the blood group matching, the size matching, and where the patient lives, how much time will the patient take to reach from his home to the hospital when the donor is available. So donor availability in India is still limited, and recipient list would be much higher. So lots of people would even die without getting the opportunity to be having a lung transplant. Lung transplant can be single lung transplant, can be double lung transplant. It all depends on what disease we are dealing with, and in majority of cases, double lung transplant is preferred. For example, in interstitial lung fibrosis, if you have advanced disease and you're oxygen dependent, you're a candidate for double lung transplant. Same way, in COPD, we prefer double lung transplant, but a single lung transplant can do if we do not have the availability of a double lung transplant. But in a condition like, for example, extensive bronchiectasis or cystic fibrosis or alpha-1 antitrypsin deficiency emphysema, we need double lung transplant. Single lung won't do that. So there are other conditions also which are relatively uncommon where a lung transplant is required. So we assess the patient very carefully and decide whether that is the right time. It should not be too late, it should not be too early. So the optimal time for transplant is something which we decide on. Thank you.